Stress is a reaction to a stimulus that irritates our physical and mental equilibrium. This is when our body releases adrenaline, which causes a faster heart rate as well as high blood pressure and quick breathing. This can also be called a fight or flight response. The fight or flight response is when our adrenaline and cortisol surge throughout our body. It is a post-traumatic stress disorder that is a physical reaction that responds to a previous harmful event. There are two types of stress, good and bad stress. We are supposed to have a little stress before a test, a game, or a social event. This stress keeps us on our toes and aware of everything. Long-term stress is bad stress. It is not healthy. This wears out the body because it feels the need to use more adrenaline or other hormones. The body feels overwhelmed and weak. Long-term stress can also cause depression, anxiety, weight issues, immune system diseases, skin conditions, reproductive issues, heart disease, digestive problems, and sleep problems. There are a couple categories for things that can give us stress. The first is our home. For example, our family members could be very ill, divorcing of parents, behavioral problems between siblings, pressure on grades, or poverty. Another area that causes stress is at a job. People stress about the demands that need to be made, relationships with colleagues, meeting deadlines, working overtime, or on holidays. Negative self-talk is also a big way of gaining more stress. Self-criticism is good to an extent. A person needs self-esteem. Overanalyzing could be very bad as well. It is important to be comfortable with yourself and be confident. Other major causes of stress is being bullied, being in a violent atmosphere, having learning problems such as ADHD, time management, and being misunderstood multiple times. There are 4 categories of symptoms for stress: emotional, physical, behavioral, and cognitive symptoms. Cognitive is mostly mental. Some examples of emotional symptoms include depression, anxiety, anger, feeling overwhelmed, and isolation. Physical symptoms consist of aches, diarrhea, pains, constipation, nausea, chest pain, flu, dizziness, and a rapid heartbeat. Some behavioral symptoms are eating less or more, isolation, sleeping too much or too little, neglecting responsibilities, using alcohol, cigarettes, or drugs for relaxation, or nervous habits. And lastly, cognitive symptoms, where some may have memory problems, being unable to concentrate, poor judgment, anxiousness, and constant worrying. Some ways to take care of stress is to not overload your schedule. Don't overthink too much, sleep at least 8 hours a day, relax as much as you can, and eat healthy. Building your resilience can also help. Building your resilience will help overcome stress. Try to solve many problems in your head. Build towards a goal. Build strong relationships and be committed to family and friends. Ask for help and be active. Another way that could help with relieving stress issues would be to be assertive. This helps in the long run. Being assertive helps reduce the frequency of being stressed. When someone lacks assertiveness, it will show low self-esteem and low self-confidence. Being assertive will enhance someone's range of communication, which in time will relieve stress. The benefits of being assertive consist of high self-esteem, less self-consciousness, less anxiousness, managing stress successfully, appreciating yourself and others more, and feeling of self-control. Relaxation is also one of the best ways to relieve stress. Either listening to music, just sitting outside, or any other way you like to relax can take some bits of stress away.